And welcome to Breathwork and Lymphatic Wellness class number 8. We're going to do something a little bit different, go in a little different direction today. We are going to look at some research on fatigue during cancer treatment. So let's get right into it. My name is Kathleen Helen. Listen, I am a lymphedema therapist. I'm board certified in therapeutic massage and bodywork. I also am a health coach and a yoga teacher and the author of the book Stress Reduction for Lymphedema, as well as the book Mindful Strategies for Adults with Adverse Childhood Experiences. So what are we going to look at today? We are going to learn a little bit more about cancer-related fatigue, and we're going to experience alternate nostril breathing, Brahmari, pranayama, and sheetali. So as in all of our classes, we start with a mindful moment. So I'll invite you to take a comfortable yet respectful posture. You can keep your eyes open or closed, whatever you'd like, and just take this moment to take a few breaths and think about what your reaction is to today's topic. Do you have any experience with cancer-related fatigue? Is somebody in your life jumping out at you as somebody who would want to learn about this information? And what questions do you have, and how excited are you to learn about some of the research on breath work helping cancer-related fatigue? So as always, we end our mindful moment with 1 minute of 5-5 breathing. We'll inhale for the count of 5, exhale for the count of 5. I'll keep the time and we'll do it for 1 minute. So go ahead and exhale and inhale, exhale, inhale, and exhale. Inhale and exhale. Inhale and exhale. Inhale and exhale. Last inhale. And the last exhale. So return to that beautiful natural breathing that you have. And we'll get started with some neck work, just some neck and shoulder rotations to warm us up for this breath work. So I'll invite you to inhale as you look up and exhale as you look down. Inhale, look up. Exhale, look down. Last inhale, looking up. Last exhale, looking down. Return the head to a neutral position. Inhale as you look left. Exhale as you look right. Inhale to the left. And exhale to the right. Last inhale to the left. And last exhale to the right. I'll invite you to take your ear to your shoulder now. So that left ear to the left shoulder. And right ear to the right shoulder. Left ear to the left shoulder. Right ear to the right shoulder. Last time to the left. And last time to the right. All right, so head back in a neutral position. Take your hands and place them on top of your shoulders. and then shoulder rolls up and back. If you can touch the elbows in front, that's great. One more in this direction and then reverse into the other direction. Really exploring that range of motion today. We're going to have some breath work in the future of this class. All right. So relax the hands and shoulders. The hands can be by the thighs if you'd like. And we'll just briefly go over our cautions. So anyone can come and listen to the class and listen to all of the research and look deeper into the research. If you are also going to practice the breath work along with us, you have to make sure that it's healthy for you. If for any medical reason you think that your doctor should give you a checkup and give the okay before you do the breath work, definitely do that. You can still listen to this entire series. It will still be here after you visit your doctor. I would especially caution if someone has anxiety problems, breathing problems, cardiovascular, and blood pressure problems. Definitely talk to your physician before doing the breath work. And even if you feel fine right now, your physician says it's great. If in the middle, the beginning, the end, at any point during our breathwork practice, you feel anxiety, you feel lightheadedness or dizziness, you have a rapid heartbeat, shortness of breath, any other physical, emotional, mental, spiritual symptom comes up, it's always okay to stop. Again, these videos are going to be here for you. You can choose to stop and just breathe normally and listen to the rest of the lesson with us, or you can choose to just pause, stop the video, and then always come back to it when you feel better. And let's talk a little bit about seated breath work. So what I was taught in my yoga class is if you can breathe, your breath is, normal breath is at 10 breaths a minute, maybe, or 20 breaths a minute. If your breath is at 10 breaths a minute, you need to be able to reduce it safely by 1/3 without having any symptoms before we want you to try to sit up and do the breath work. So if you count your breaths for a minute, you normally breathe 10 times. I want you to be able to comfortably breathe 7 times a minute before you try a longer practice seated. And we need to know, there's research, we looked at it earlier in a previous class. It is not necessarily better to do breath work seated. This is maybe an ego thing, it may be a tradition thing, but it's not a science thing. And in fact, there's research out there that shows that breathing while you're lying down, while you're lying supine, actually helps move fluid through the lymphatic system. So seated breath work is okay, but lying down as you're doing these breathing practices is just as good or maybe even better, depending on how much lymphatic fluid you want to move in this breathwork practice. Okay, and then when and how do you practice pranayama? We want pranayama to be started once the yogi has a solid practice of yoga. We would really recommend that you do it on an empty stomach, empty bowel, and empty bladder. So definitely pee before you do the breath work, and go to the bathroom before you do the breath work, and don't do it on a full stomach. You could, but it's just going to feel uncomfortable having a stomach full of food and you're trying to breathe and the diaphragm's right there. And then also, if you can nose breathe, focus on nose breathing. Not all of the practices today want you to inhale through the nose, but as a default, we love the benefits of nose breathing. So let's look at cancer-related fatigue. Let's look at some research on that topic. So these researchers tell us cancer-related fatigue is defined as a physical, emotional, and/or perceived fatigue or tiredness with a persistent and subjective sense related to cancer or cancer treatments that are disproportionate to recent activities and interfering with usual functioning. So I understand everyone gets tired after a busy day. We're all tired, but cancer-related fatigue is over and above that. Cancer-related fatigue is someone who has had the cancer treatment, and this level of tired is disproportionate to their recent activities. They just don't understand how they can be this tired after not doing that much. And this fatigue is interfering with their usual functioning. For those two reasons, we really want to help people who have cancer-related fatigue. And we need to know that pain and fatigue are linked. The researchers say that pain with moderate and severe, patients with moderate or severe pain mostly have moderate or higher levels of fatigue and a lower quality of life. And there's a strong correlation between their symptoms and their reduction in quality of life. Pain is an aspect of it too. So let's, as my dog thinks there's someone coming in the house and wants to emphasize to you to think about pain in your clients that have cancer-related fatigue, we need to look at this wonderful randomized controlled trial on the effectiveness of pranayama on cancer-related fatigue in breast cancer patients undergoing radiation therapy. So this is a fantastic study. I especially appreciate it because it's specifically looking to help clients as they're in radiation therapy. So let's look at the protocol. So this protocol was performed both morning and evening for 5 days a week for 6 weeks. And it started on the day they started radiotherapy until their last day of radiotherapy. And if you look at what's happening, it's just this 18 minutes in the morning, 18 minutes at night that they set aside to do this breath work. So they did 3 different breathwork practices: Nadi Shodhana, which is the alternate nostril breathing. They did sheetali, which is breathing through the tongue and then exhaling through the nose. And they did Brahmari, which is making a bee buzzing sound as your fingers are over your face. So this may be completely new to our patients, our clients, our friends and loved ones that we're thinking of. So we're going to take it step by step in this class. It should be maybe something you've already practiced before if you've been looking at the classes. But today we're going to put it all together. And we're going to do it slowly so you can kind of practice. And I want you, you can look at this video over and over again as many times as you want. It's on YouTube until like you feel confident, or ideally you want to share this with a loved one. You can go through this video together. But let's look at the facts. And I see this is a picture of radiation, is radiation of the head and neck. And this is for breast cancer. So this is for the breast cancer trial. So it's 160 patients were involved in this randomized controlled trial, and they found a significant difference between the two groups with regard to the scores of cancer-related fatigue. So they did see a difference. And the experimental group of patients who performed pranayama along with the radiation therapy experienced less fatigue. So let's look at the 3 individual practices. The first one is Nadi Shodhana and lymphatic health. And you'll see they're making this is the hand gesture that goes along that helps us do this position. So you'll see my index finger and my middle finger are on kind of the meaty part of my thumb, and the other 3 fingers are straight up. And we're going to actually be using the thumb, like you see the lady's thumb, and then you see the ring finger, and those are going to be what shuts each nostril as we do it. So just to kind of get you familiar, and I find that the hand position is the hardest thing. Once you have the hand position and you kind of do 2 or 3 rounds, you kind of get into the rhythm of the alternative nostril breathing, and then it becomes much easier. So let's look at what the link between Nadi Shodhana and lymphatic health is. And this is actually a really strong, a really good link, because the Institute of Applied Dermatology in Kerala that I was able to visit a few years ago, it published a protocol, the yoga protocol for the treatment of breast cancer-related lymphedema, and they included Nadi Shodhana, the alternate nostril breathing, in that protocol. And just to refresh, Nadi refers to energy channels in the Ayurvedic system of medicine, which is native to India. And Shodhana is a word that means purification. So that's why you see Nadi and you see Shodhana as the title. So there are some differences, and there's a lot of, especially if you study like in yoga circles, yes, you can say that Nadi Shodhana is a little bit different from alternate nostril breathing, but for the purposes of this class, I will just use them interchangeably. So let's talk about Brahmari. So that is bee's breath. So we're making this sound kind of nasally from the throat of like or how a bee buzzes, or just the sound. And you'll see, I love that this lady has her green nail polish, so you can really see where her fingers are for this breathwork practice. So 1 or 2 fingers can be over the eye and the eyelid. A finger can be alongside the nose. The air is going to come out of the nose, so you don't want to close the nose. And then the other finger can be near the mouth. And then this ring, the thumb, which you see clearly on her, is actually shutting that ear. So you can really hear the sound reverberate inside of your skull. So that is the hand position. And really, you don't have to do the entire hand position. It is nice to plug the ears while you're doing this, and then just close your eyes, close your mouth, and breathe out of your nose. Okay, so according to a study, regular Brahmari pranayama practice has been demonstrated to lower the blood pressure and also treat migraine and chronic headache issues. So this is a kind of breathwork that's good for more than just cancer-related fatigue. Doing Brahmari pranayama while exhaling through the nose encourages the creation and release of nitric oxide, which widens the artery, promotes the flow of blood, and maintains the heart's oxygen supply. And let's talk about sheetali. So sheetali has its own position as well. You're curling the tongue. You're curling the tongue and breathing in through the curled tongue and then out through the nose. So sheetali had another research with blood pressure, and that involved 30 patients aged 60 to 75 who had hypertension. They were on beta blocker medications, and they did a 10-minute sheetali practice in the morning and 10 minutes at night over a 12-week span. And this research found that sheetali pranayama appears more effective for lowering systolic and diastolic blood pressure, serum cortisol, and increasing nitrous oxide in hypertensive elderly. So again, more good things that come from practicing this type of breath work. It's going to lower your blood pressure. It's going to lower your cortisol. It's going to increase your nitrous oxide if you practice it similar to this protocol. So what happens during sheetali? The researchers found that it altered sympathovagal tone, and that contributes to a relaxed feeling and improves cerebral blood flow, uptake of oxygen, and total parasympathetic stimulation. So that's the relax, digest, relaxation part of the nervous system, the parasympathetic stimulation. Practicing sheetali pranayama lowers people's stress levels, which results in a mental calm. So let's try it. So remember these 2 gestures for the alternate nostril breathing. We're going to be using this hand position with the index and middle fingers are inside of towards the base of the thumb, and we're going to be using the thumb itself and the ring finger to close off our nostrils. And then the Brahmari pranayama, if you want to place all the hands, all your fingers over different areas of the face, or else you can just, if that's uncomfortable for you and for your hand, it's not comfortable for everyone's hand, I would just recommend closing the ears off so you can really hear the sound reverberate inside of your head. So we'll start with Nadi Shodhana. So we'll have you, I'll invite you to sit in a comfortable yet alert position with a straight spine. You can close your eyes if that feels comfortable, and then begin by taking a few diaphragmatic breaths, and then hold your hand in this mudra, which we call some Vishnu mudra or Uh, and basically it's the index and middle finger are held at the base of the thumb. And these, our worker fingers, our thumb, and our ring fingers are going to help us close off the nostrils. So we're going to do this for 5 minutes, and I'll go ahead and start now. So go ahead and exhale with both nostrils, and then close your right nostril with your thumb and exhale through your left nostril. Inhale through your left nostril. Close the left nostril with your ring finger. Exhale through the right nostril. Inhale through the right nostril. Close the right nostril with the thumb. Exhale with the left. Inhale through the left. Close the left with your ring. Exhale through the right. And you'll see I'm just reading these directions from top to bottom. Inhale through the right nostril. Close the right nostril. Exhale through the left. Inhale through your left nostril. Close the left nostril. Exhale through the right. And then inhale through the right nostril. And then I'll leave you to do the rest of it on your own at a pace that's comfortable for you, following these 4 directions over and over again. I'll keep the time. I'll let you know when we have a minute left, and then I'll let you know when we're done. We have 2 minutes left. We have 1 minute left. Okay. The next exhale, let the practice go. And then take a few deep breaths before you're not through your nostrils before ending the practice. Now we'll move to Brahmari pranayama. This will be harder for me to guide you through because your ears will be closed, but I will keep the time and we'll do this type of breathing for 8 minutes. So I'll invite you to close your eyes. You can place your index, middle, and finger on your eyelids, your thumbs to close your ears, and your ring finger by the nose. Inhale through your nose for 5 seconds. And then exhale through the nostrils with a buzzing sound like a bee or owl. Inhale for 5 seconds. And then buzz like a bee for 15. Then repeat this, and I will keep the time, and I'll let you know when there's 1 minute to go. There's 2 minutes left. There's 1 minute left, so this is your last 3 breaths. Okay, so we've done it for 8 minutes. We've done 8 minutes of Brahmari pranayama. So let's look at the last practice. We'll do this for 5 minutes and it's called sheetali breath. So we're curling our tongue just like the lady does in this image, curling the tongue to form a tube, closing the lips around the curled tongue and inhaling through the tongue, exhaling through the nose. So we can do this as fast or slow as our lungs want us to do it. And we'll do it for 5 minutes and I'll keep the time. So let's start by inhaling. And exhale through the nose. Inhale through the mouth. Exhale through the nose. Continue on at your own pace. One more minute. All right, so go ahead and finish your last breath. And that is 5 minutes of sheetali practice. So we've spent almost 20 minutes doing these 3 breathwork practices. Let's take a moment, breathe normally, naturally, and just check in with ourselves. How do we feel after the practice? And once the video is done, I would love to see in the comments your responses to how you feel after this practice. So let's look at another type of breathing that can help people who are cancer survivors. So these researchers found that slow breathing offers benefits in pain relief, specifically that slow, deep breathing is effective for pain relief if the breathing was paced as a slow rhythm with the expiration longer than the inspiration. So the amount of time that you inhale is shorter than the amount of time that you exhale. This may offer benefits in pain relief. So how does slow breathing work? The researcher says it's believed that slow, deep breathing activates the baroreceptor system, which dampens pain through the cardiovascular and our central branch of the system. So what does this look like specifically? They did 4 randomized controlled trials, and they found that around a half an hour of slow pursed lip breathing exercises had positive effects on post-surgical pain management compared with routine care. So this is, you're already getting your routine care at the oncologist. What else can you do over and above routine care to help reduce post-surgical pain management? So slow pursed lip breathing is slow, deep breathing with the lips pursed during the expiration. So it's tight O with the mouth, like you're blowing candles out, like you're pursing your lips. And it requires the time ratio of inspiration to expiration at 1 to 2 to 3. So this is a good formula that we can use to determine how long our exhale would be according to how long it takes us to comfortably inhale. So if we can inhale at a count of 4, then we want to exhale at a count of 8 or 12. So it's 4 times 2 or 4 times 3. So let's try it. We'll try it just for a minute here with the inhale of 4 and then the exhale of 8. And the exhale is going to be with pursed lips. So go ahead and inhale. Exhale for 8. Inhale 4. Exhale 8. Inhale 4. And exhale 8. Okay, so we can return to breathing normally. So this was just for a little around a minute, just 3 breaths, but the researchers found if you continue doing that for a half hour, it could have positive effects on pain management after surgery. Okay, so we looked at actually quite a lot of breathing, 4 different breathing practices today. We tried them. So as we do in every class, we end with another mindful moment. So I'll invite you to once again come into a position that's respectful yet comfortable. You can keep your eyes open or close them if you want. Just take a few nourishing breaths and bring to mind all that we learned today, all that we practiced. We learned about cancer-related fatigue. We learned its link to pain. We looked at 3 practices that can help reduce cancer-related fatigue. We learned about the other beneficial things that happen when each of the practices are used. And we ended with a breath work that helped reduce pain after surgery. So if you have any other questions about these topics, please include them in the comment section. And don't mind my dog. My husband just came in. And you can find the full free 10-session breathwork and lymphatic wellness class here on my YouTube channel. And here are the resources. Okay, everybody, thank you so much for accompanying me in this class, practicing all this breath work. And here are the resources, and I look forward to seeing you in the next